Good afternoon. This is Dr. John Bennett from the Larkin Hospital TV station in Miami, Florida. Today we have the pleasure of having the CEO of Bestic Incorporated from Sweden, Katharina Borgen-Stierna, MD. I'm not sorry, MD. She's a PhD, right, Katharina?
No, I'm an
Okay.
MBA, but
Okay, I'm sorry. Well, she'll introduce herself and what she's doing, and we're also joined by a panelist from Michigan, Ven Milbury. Hello, Ven.
Hi, Dr. Bennett. How are you doing?
Can you tell us who you are and where you're at and stuff?
Yeah, I'm Van Mulpuri, like you mentioned. I'm an internal medicine physician from Michigan. I'm glad to be here to learn more about the robotic stuff.
Okay, very good.
Yeah.
Okay, Katharina, could you please introduce yourself and how you came upon the project before you go into your presentation?
Absolutely. Okay, so my name is Katarina and Borgenstierna, and I've been working with this very interesting device for eating for those who are being fed. And it started 5 years ago when I met a man called Sten Hemmingsson, and he was suffering from post-polio, which made it difficult for him to use his arms and hands. And since he didn't want his wife to feed him every time, he was looking for a good device for gain independence. So that's when he started the project, and today it's a medical device that is used by many people for different reasons if they can't manage eating by themselves. I will just give you some introduction and background to the whole sort of mealtime situation, both for elderly and individuals with disabilities, and then I'll just show you how the device works.
Very good. Very good.
Okay, good. So I'll go to the...
Okay, I can see it. I can see it. Fine.
Okay, perfect. Starting with eating difficulties in general, I'm just going to go through a little bit about the research, therapy in general, and assistive devices, and to give you the background, because it's quite interesting, the mealtime. It's both the medical reasons we have to eat for nutrition purposes, but it's also a social reasons, a lot of things going on during the mealtime, which makes it a complex area for care services. And as I briefly explained, this whole project was started by this man that you see. I hope you can see him now. His name is Sten Hemmingsson, and his wife. And his vision was that he could eat together with his wife, look her in the eyes, and not having her help just putting food in his mouth. And for him it was very important to be independent and had only about dignity to preserve dignity and manage your own meal. So his story was that when he got post-polio, he suffered from it, and he couldn't use his arms to lift them as much as he would like to. And if we look to elderly, when we grow old, can you see this slide? Many aspects.
Yes, we can.
Yes. As we grow older, there are many factors which changes our way of eating, both psychological factors, but also it could be physical disabilities in different ways, both motor disorders, cognitive disorders, oral health, perception issues, and also when we get older, we also tend to our taste sort of deteriorates, and we don't have as many senses as strong. And if we're used to living together with someone and they might pass away and we have to eat alone, we eat different. So this whole concept of mealtime changes with age. And all of these factors, they can lead to what we call eating difficulties. And these eating difficulties are sometimes registered and sometimes not. But I want to give you some examples of different kinds of eating difficulties that could arise. One of the most common difficulties is the positioning, how the person who's eating is seated. Sometimes we have seen about 50% of those with eating difficulties are positioned wrong or incorrect, making it really hard to swallow and making it hard to use your upper limbs. Some people have difficulties managing or handling food on the plate to get it up on the spoon or the fork, or just bringing it up to the mouth. Some people have difficulties managing the food inside the mouth. Swallowing dysphagia is a common area, and not the least, the lack of energy. We see that many people could actually fall asleep almost while eating, and it's not because they are perhaps very full or happy with the meal. It's just because they don't have enough energy to complete the whole meal. If you look to one study in a nursing home or a elderly care home, there was research showing that 87 of these persons had some kind of eating difficulties. And mainly, most people had a combination of these difficulties. So it's not just one person, one difficulty. But as you see, if you ever heard of coughing could be a sign of, or choking, of difficulties to swallow. And it's not normal to be coughing while you eat just because you're eating. So it's actually quite common. So we have asked ourselves, okay, but who are these people who are actually being fed today? We have looked into statistics, and usually the people we meet are neurological disorders. Mainly, for example, ALS group, arthritis, cerebral palsy, Parkinson's, stroke, different brain injuries, also pain, and it's really hard to know exactly the number of how many people are being fed, because it's not usually noted in the patient records. But in a European project that we were part of, they estimated that about 0.2% of the population is being fed for different reasons. And for the USA, this would be as many as 630,000 individuals. So quite a big group that are being fed. And what we know that these eating difficulties, and which feeding is part of, is that they could lead to this negative spiral. If you don't feel very well and you lack an appetite, you may not eat very well, you have a decreased nutritional status, and so on. And if you have a decreased nutritional status, it's much easier for you to get infections, it's easier to fall, and you come into this negative spiral that you really don't want to come into when you are elderly. And what research clearly shows is that eating difficulties, they lead and they contribute to malnutrition. And malnutrition or undernutrition is a serious problem in the society, and it costs enormous amount of money. And for those patients, if you stay in a hospital, the cost arises when, even if you come home from a hospital, you usually come back much quicker to the hospital. If you don't have a good nutritional status, you tend to stay much longer inside the hospital, and it's as I said, when you come home, it's easy to come back. So it's really important to work with eating difficulties to address malnutrition. When we are out discussing with nursing home or individuals with disabilities, we're often getting the question of the robot issue. And care staff can be quite frightened, actually, of the concept of having robots and taking over, a hostile takeover of the nursing home. and they see all this Terminator Hollywood pictures in front of them, and can be afraid that this is something difficult. What I usually say that for us, an eating device is not about a robot automatically putting a lot of food into the mouth. It's not. It's an eating assistive device, and it's for everyone who are just interested in eating by themselves. So you're not being forcefully fed. It's only about those who wish independence. And what we see is that for those who are being fed, sometimes if we look for home care staff, they might have 30 minutes to prepare the meal, serve the meal, feed the person, and clean the dishes. And 30 minutes is not a long time if you also have eating difficulties. So it's not always as positive to have. Oh, sorry, I got out. To have lots of staff feeding you. And I also want to draw a parallel into the assisted devices for mobility, which has a much wider range of tools to use, depending on your need of support. If you have low degree of need of support, you can use a stick, for example, or a walker. And if you have a higher need of support, you have an electronic wheelchair, which is not really strange today. It's quite common. It's not about the chair taking over. It's about giving a various degree of support. And in parallel with eating, it's only very simple tools are being used today, like thick cutlery or plates with a special edge, cups. And then if that doesn't work, you have to go to a manual or a person, individual feeding you. Can you see me changing slides? I'm just checking.
Sure. Yeah.
Good. So what is important is that this device, it's called Bestic. It's Swedish for cutlery, and it means that it's the user who operates it. So by at least pressing a button, you control the spoon. And for most people, it takes around a meal time to know how to operate it. And it's a small device. It weighs 2 kilos, and you can bring it with it to restaurants. You can eat with it outdoor. And Sten wanted it to look very nice to put on a table, which is set. So like a kitchen aid or kitchen tool. And so it's designed to be compact and easy to bring. And here are just some examples of joystick or buttons that you use to control it. And we've made 2 major studies for evaluation, one in Denmark and one in the US. And what is very clear, and for all the feedback we've had so far, and we've had more than 250, 300 devices out today, is that the users are usually very happy. Most of them say, "Oh, it feels so much more dignifying. I feel like a human again, and I'm able to have a private conversation. I can eat more. It tastes better when I'm eating by myself, and it just gives more confidence and a higher quality of life to decide your own pace." And from the caregiver's perspective, they also could say that, oh, well, actually this creates a less stress, because the working environment can be quite stressful around the meal times with a lot of things going on. They also said that it was more equal communication between the resident, the user, and the staff, because it just makes it easier to communicate while eating. But they also say it does require a positive attitude for management and care staff to be successful. And in this case, this was a project with the Good Samaritan Society, and they said that, well, actually the total duration of the mealtime, in fact, also decreased. What we've seen is also some medical benefits, that many users say that it's easier to swallow, less coughing, and actually eats more nutrition. So again here, 98% of these users thought it was a good device, a good invention, and that the device worked very well. And they thought it was very enjoyable to not to be fed too fast or too slowly. I can give an example where they say that, for example, I can see on the caregiver's face that they are actually thinking about other things than me while they're feeding me, and it's a bit stressful to see that. So what we have worked with also is a lot different professionals surrounding the meal, and just acknowledging that the mealtime is actually quite complex in care. It's, as I said, both a medical responsibility and a social responsibility, and a lot of professions involved. We have a dietitian giving directives on what kind of nutrition. We have a speech therapist involved. We have dentists, can be an occupational therapies, different assistant, nurses, physician, relatives, and more. And then all these professions interact, but it's not always clear in what way and who is responsible for what, as to make the whole picture. And sometimes we also forget to ask the individual what their needs, interests are. So we have been working a lot to create a whole holistic view of the mealtime, to work from 7 different perspectives, and have developed also a quality tool to measure this. I will not go through this all in detail, but just to clarify responsibilities, review the seating and the positioning to come close to the table, to have a good oral health, mouth health, nutrition, as I said, to always discuss and lift the issue of independence is important. And for social aspects, some individuals have difficulties to have a conversation and eat at the same time. We know, for example, with Parkinson patients, they can have real difficulties of talking while they're eating, and may need to be quite alone while they eat. And also that the whole mealtime can appeal to all the senses. So this is an example of one also a very happy person called Chad. He had a spinal cord injury when he was young, riding a bicycle, and has very high, I think it's C4 injury from the neck and down. And he was so happy from the age of 35 that this was the first time he'd been able to eat by himself in 18 years, which means a lot. So our work is just to create a positive experience based on all these aspects around the mealtime. And we work with all these fantastic care professions to provide this and help them with services and training programs. So now I'll go back and show you how the device actually works.
Okay, very good.
Good. Good. So this is the device. It's an arm which has a spoon, comes down, and before you start to eat, you set the spoon to be comfortable for you to take the food with your mouth. Mm-hmm. I will show you. I press the button. There's a button here. When I click it, the spoon comes down to a plate and starts to rotate up and down. When I press again, the spoon moves to the side. Oh. The food up, back, and scrape off the sauce or gravy.
Okay.
Here I take the food.
Very good.
So if you can press one button with any part of your body, it doesn't have to be your finger. You work with head, shoulders, toe, knee, whatever you have that you can control or move. And if you have tremors, you can place this button underneath the table, for example, and wherever you feel comfortable. So I will show you again. I press it once.
Okay.
Comes down. And it starts to move up and down. And the second press will stop it. So I press now. And then it picks up the food to the plate. Backs, wipes the gravy, and then comes up to the mouth. Oh, that's about it.
That's okay. It's okay.
The device looks like this.
Okay.
And you just put these two sort of feet.
Mm-hmm.
I call them feet next to the plate.
Okay.
So you set them to the plate, and this is just a normal plate with a not anti-slip mat. You put the plate here. You have the food. You have the button. You press it. The spoon comes down. Starts to move. And then when I select the meatball I want, I press again to get it.
Mm-hmm. Okay.
So it doesn't require any technical installation. It doesn't a lot at all. And we have for also backpacks, so they can easily be brought outdoors or wherever.
Okay. Very good. Very good. So that's it. Okay. Very good presentation, Katharina, for something that seems to have a tremendous amount of need for many, segments of the population, like elderly and neurologically damaged people.
Yes.
And I'm sure Ben and I have a couple of questions. Let me just start things off. Does it take a person a little while to learn it? How long is it? I guess it varies from person to person, depending upon their disability. But is it fairly easy for patients to learn? What's your experience?
Yeah, our experience, it's very easy to learn to use it. I think if you have one lunch with it, you know how it works.
Okay.
But then it's also a bit of getting the habit of using it. So we usually recommend that you try it for a week or a few days, and then you know how it feels, because it's the social experience as well to bring it, and if you feel comfortable with it. But many of our users do, and they are very happy. And we have our youngest user is, I think, 3 years old.
Wow.
So also children can use this, and our oldest is perhaps 103.
Wow.
So this need for independence is not really age dependent. It's all about your abilities to manage yourself.
Well, when you it's such an important task. I mean, you take it for granted about being able to eat, and you don't think about it. But when you mention the social aspect of it, that certainly applies. Ben, do you have any questions?
Well, yeah, I mean, I have a lot of questions actually.
Go ahead.
I'm just wondering, again, you need a staff to assist with the person. Like, it's not like, if you have that, it's not going to come to you, or it's again, somebody has to put it in a place where, it could be reachable to the patient, right?
Yeah, someone needs to cook the food.
Yeah, I know, but someone needs to adjust the things also, like putting the robot at place, like near the plate or something. Because the other person, he's not able to use his hands, basically.
No.
Yeah. So.
But you are the independence you gain is the whole just process of eating.
Yeah. So yeah, that's right. Yeah.
But not the disease or anything like that. No.
I mean, again, it's like there are a lot of limitations with this, right? Like the food has to be prepared in certain way so that it could fit in the spoon or whatever. You can't eat different kinds of foods. Like suppose if you go to a hotel.
Yeah, you can eat. I mean, hamburgers are difficult, but right. As long as it's a spoon size of food, anything that we can manage to eat with a spoon can be managed by this device. But most people who are being fed are actually already being fed by a spoon. It's not very common to be fed with a fork or like that. And so you can have soup, you can have pieces. We have persons are seated in front of the TV in the afternoon. They can have a snack in front of the TV, which they couldn't have previously. Just to have some potato chips or candies could be quite valuable when you're never able to eat by yourself.
Okay.
And just not to be stressed, just to have 10 or 15 minutes to finish a meal, but it doesn't matter how long you eat.
Right.
Even if you're slow.
Well, you know, Catherine, one thing you mentioned is that some healthcare workers are intimidated. They're scared of the robotic aspect of it. But you know, that applies to a lot of things in medicine. When something is new, for example, computers and smartphones, you know, everyone was kind of wondering, what the heck is this going to do? You know, is it going to take over our job? And I can remember when ATMs came out, with the banking ATMs.
Yeah.
I hated it because it was new. I think it's just natural to be kind of scared of something new, and this is something new for the nursing home nurses and stuff. But I think once they see that it's useful and the patients like it, I'm sure you've experienced that, correct?
Oh yes. As I said, we worked with almost 300 persons today, and I mean, most people, they're really. I mean, some people cry for happiness for just being able to. Yes. It's really hard to explain with words. But I always tell people, go home and ask your partner to feed you, and you're not allowed to touch it. Just get the feelings in your stomach of how it feels. You can't decide what piece of the food you put into the mouth, what speed, to wipe your mouth. It's frustrating.
Right. Yeah,
and that's what I tell the care staff. Please practice on yourselves and take turns feeding each other, just to get the sense of how it feels to be fed.
Okay. Ben, you have some more questions?
Yeah, I'm just wondering how much it costs, this particular device.
Yeah, it costs. You can buy it for $3,900, or you can rent it. You can rent it from, I think it's $150 per month. And if you compare that with the cost of being fed by an individual, if you're being fed for like 30 minutes, maybe that's the cost of $15 or something.
Okay. Well, that brings up a point. Katharina. I would imagine that her nursing home people like it because it frees them to do other things instead of sitting there feeding someone.
It is quite ergonomically challenging to feed someone for 30 minutes.
Right.
It is.
Yeah, it frees them up. They can do other things, you know, rather than feeding the patients. Not everyone, but I mean, I'm sure the people that use the machine well, I'm sure they have more time in their hands to do other things.
Yes, exactly. So that's the sort of care staff benefits also. And as I said, if you can talk to someone and look them straight in the eyes, it's a much better communication than having someone seated just right next to you, behind you. That it's not the same communication to have.
Right. Yeah, that made me think when you mentioned the social aspect of eating. You never think of it, but that's true. It's a very social thing.
Yeah, it is.
The other question, Catherine, is how efficient are these robots? I mean, sometimes they might spill, or accidents might happen. It's kind of embarrassing, situation. Like, if it is pouring in the face, putting in a different place. Those kind of things might happen, right?
Yeah, sure. It can. I mean,
it's a learning curve. It's a learning curve. You just gotta learn how to use it.
It's actually quite uncommon that you spill a lot. You may spill something on the side, but not very much.
Okay.
So I think it's much less spillage. If we talk to the people with tremors who spill, they spill all over themselves.
Right.
That's sort of normal.
That brings up a good point. Are there certain foods that you can't really use this for, or like soups? Can you eat soups with this kind of thing, or is it difficult?
Soup is perfect. I will show you.
Okay.
I will show you. You can take off this spoon. This is the spoon.
Oh, soup. Okay.
Anything that you can use with the spoon is or spoon-size food.
Okay.
So anything we can eat with this device can use. So not long spaghetti. Hamburgers are difficult.
Right.
But pizzas are But
Food you have to cut, right?
you have to cut. You have to cut it. Yeah.
Yeah, yeah.
But otherwise, they work.
So it comes with different spoons and different, you know, like maybe knives, or, you know. Does it come with different things? Like
It has different sizes, so you have tablespoons or.
Can you show us? Can you show us the different attachments to it? Do you have them with you or no?
No, I don't have them with me,
Okay,
unfortunately.
okay, that's okay.
But we have
a fork, a spoon, a knife? No, or just a spoon?
only spoon.
Spoon, okay.
But small and large.
Yeah, that's good enough to get the food in your mouth, I guess.
And also, it would have been nice, you know, if you got a video or something. I mean, it's really real life feeding, like it's really feeding a person, like a visible person.
We have some videos on YouTube for different users who are eating real food. So you can go on YouTube and search for Bestic, and you will see a couple of videos there for people.
Okay. Okay, so just go to YouTube and look for Bestic robotic feeder, or how would you put it?
Yeah, just search for Bestic.
Bestic? Okay. You'll come to it. And you have an office in the United States, in Boston, correct?
Yes, we have an office in Boston, and we work with the Veterans Administration System. Unfortunately, we have a lot of veterans with neurological disorders and damages, so we are happy to help those who are interested. We also work with the ALSA patient organizations. ALS is a big group for us. We also work with children with cerebral palsy, so that's quite common. And we participate in conferences in Florida. We will be in Florida, Orlando in August, end of August.
Okay.
And also in San Diego in November.
Okay, yeah. Florida has a very high elderly population here. A lot of nursing homes here.
Yes.
So I imagine that's your number one market, correct?
Actually, it's more home residents who lives at home.
Oh, people that are homebound, like neurological disorders that are homebound?
Yes, that's our most common. But we will see. I mean, this could be actually used in hospitals also.
Right.
And we saw also people with the stroke coming out of the hospital. They may just need support for a period of time, and then they improve. But while they need it, they actually tend to eat more food, and it's really important for neurological patients to have a good nutritional intake.
Has this been on the market very long?
No, it's been out for about 2-3 years.
Oh, okay. So, do you have any hospitals that buy them, or is it strictly private people?
It's usually either, as I said, the VA system, or for example, patient organizations or rehabilitation facilities.
Oh, okay. Yeah, that would be a big client, the VA system, if you could get them as a client.
Yeah.
They're all throughout the United States.
Yes,
but,
yeah.
Very good. Go ahead, Ben.
I got another question.
Yeah.
I mean, how can it help with somebody who is, having problem with dysphagia? I mean, like if he can't swallow, putting the spoon at mouth, it's not going to help him, right?
No, it doesn't change in itself dysphagia. If you have dysphagia, you have dysphagia. So.
Right.
No way of curing that.
Yeah.
But you mentioned, in the list, like, you mentioned, people with ALS and those kind of people.
Yes. And the reason is, I will show you why. I will take off the spoon here and show you. If you are being fed, many people who feed others put the spoon in and then they pull it up and they scrape the food off behind your front teeth. So most of the food ends up in the top of your palate. Okay. Which makes it hard to chew and swallow.
That's right.
You can't control the volume. Here, the spoon just sits in front of you, and you yourself have to
move your mouth.
Yeah. Okay.
And when you bite it, you get the food down on your tongue, which gives you much better control of the volume and the speed, so you can manage swallowing much easier.
You're right. If you take the amount as much you could. Right, basically the amount that you could.
You referred to that. You referred to that, Catherine. You said you can feed at your own pace.
Yes.
Right.
You don't have someone feeding you at their pace. You do it at your own pace.
Yes, exactly.
It's such a important thing. It's something we don't think about. You don't think about it. You know, where you put it in your mouth. You just take it for granted. I just eat, but when you break it down, it's certainly important.
Mm.
So, okay, well, very good, Katharina. I think you've given a good overview of what the device is. A very useful device for certain populations, and we wish you luck.
Thank you very much.
Mark,
Thank you, Catherine.
in the United States,
Thank
and
you very much.
anything we can do to help you, we'll try to help you. And thanks for coming, Ben.
Thank you. Thanks for having me.
Thank you very much.
Keep us up to date of any new developments.
Absolutely, I will do that.
Thank you.
Thank you.
Thank you.
Bye-bye.